opioid abuse has been in the headlines nationwide and here in the Commonwealth. This is also a large problem in New Bedford, as Massachusetts Department of Health statistics reveal there have been at least 25 opioid-related deaths in New Bedford in each of the last 3 years. How do you propose to deal with the opioid crisis and with the problem of drug abuse generally? What can the city do to help people who are currently addicted and to prevent others from becoming addicted?
Unfortunately, over the last 30 to 40 years, whatever we're doing to try to fight the drug problem is not working. We have a real crisis in New Bedford regarding the opiate issue. What we need to do is go after the people that are selling the drugs. We have to help the people that are addicted to the drugs, and there is a lot of help out there. I truly believe that a 30-day or a 45-day or even a 90-day program is not enough. That's just not going to help somebody who is addicted to a lot of powerful drugs, and a lot of prescription drugs are very powerful. So what we need to do is go after, find the resources, and ask for help from the state and the federal government to combat the people that are selling these drugs. That's the first step. Second step is trying to find the people, help them get the help that they need. We have to extend, we have to go to these halfway houses and say to them, and these programs that we have, and say to them, 30 days and 45 days is not enough. What can we do? And after that program, there should be more oversight of what happens to these people when they leave the program. You just don't put them back out on the street without having a job, without having some connection to back with their family. We need to bring families and the community back and help these people. There's the ongoing issue about the new sober house on Hawthorne Street. And the only reason why that came up is where it's located, because many other communities in this city have been dealing with this. The opiate houses, the sober houses need to be more in a commercial area, not in residential. We should not have these homes next door to mom and dad. It should not happen.
Thank you. Now, Mayor Mitchell, I'll repeat the question. The issue of opioid abuse has been in the headlines nationwide and here in the Commonwealth. This is also a large problem in New Bedford, as Massachusetts Department of Health statistics reveal that there have been at least 25 opioid-related deaths in New Bedford in each of the last 3 years. How do you propose to deal with the opioid crisis and with the problem of drug abuse generally? What can the city do to help people who are currently addicted and prevent others from becoming addicted?
So the opioid problem is a really big problem. It's a very American problem. It's not unique to New Bedford, but it is certainly something that pervades the United States. A recent study showed that some 75% of the opiates consumed around the world are consumed by Americans. And so this is because it is a national problem. The state and the federal government have to act. They have not been quick to act, but they do need to act. And it was interesting the other day that the president noted that some 4 out of 5 heroin addicts started out with prescription drugs, and I think that's really the place, the first place, not the only, but the first place where the state and federal government should begin. Governor Baker's proposal to restrict opiate prescriptions to 3-day scripts is a really good start, because that has become, painkillers have become a gateway to addiction far too much in our society. We in New Bedford have not waited around for the state and the federal governments to take the lead. We have focused on an effort that has really 4 components: interdiction, emergency response, treatment, and education, all 4. We were one of the first communities in Massachusetts to arm first responders with Narcan, and that has saved dozens of lives in the last roughly year and a half. We've assembled an interdepartmental task force to deal with our responses, whether it's about coordinating treatment or education, or some of our other efforts around public health efforts around opioid abuse. And we have also taken the lead in education. We need to keep our kids off of opiates. And so we have integrated into the health curriculum at the high school instruction on opioid avoidance and sensitizing kids to the risks associated with them. We've also are also putting Narcan in our schools, and I will just note very quickly, we hope we'll never have to use it, but it's there if it's needed.
All right, you can follow up on that thought in your rebuttal, but first, Ms. Giesta has a minute for her rebuttal.
Well, again, the problem is not asking for help. We do need to ask more help from the state and federal government. We have a crisis here in the city, and I understand that the community is involved. It is really troubling to me, and I'm sure to a lot of parents, that we are having Narcan in our middle and high schools. And so that clearly demonstrates again what a problem we're having. If it wasn't because that something happened at the high school or the middle school, I mean, we're talking about a bunch of 12, 13, 16-year-old children, ladies and gentlemen. Why is Narcan being available in middle and high school? So that, a child is overdosing on a prescription drug? So again, we need to ask for more help. We need to be more involved. We need to get parents more involved in their child's lives. And we need to have more assistance, again, from the state and federal government, because this is a big crisis.
Thank you. Now it will be your turn, Mayor Mitchell.
Yeah, I agree. We need more assistance from the state and federal government, but we're not going to wait around to act, and we haven't done that. That's not what we do in New Bedford. We're proactive. We get after our problems, and this is another example. It's a big problem, and it's bigger than New Bedford, but that doesn't mean that we don't take direct steps to deal with it. We have gotten some state funding through the Prevention Wellness Trust Grant that our health department is using. That's helping some of our efforts, including in education, to deal with the opioid problem. But it's not enough. We need to coordinate it. We need a coordinated effort. It just can't be done at the local level. The state and federal government really have to jump in.